it was a trap, my humans did not bring me to the park like they said they would. Oh, hey, I'm Sig. I'm almost 4, I have a lot of energy, and apparently I'm what they call a large breed deep-chested dog. I don't know what that means exactly, but I do know it sounds impressive. It also apparently means I'm at higher risk for something called GDV, from which I understand is not a fun time. Although this isn't your average park, I can't lie, it is pretty nice in here. Oh look, fish! I like fish. My humans had already filled out all of the paperwork before we got here, so we didn't have to wait around, which is great because I am not a very patient doggo. I operate on a right now or I scream type of schedule. We met one of the humans who would be taking care of me today. They answered all of my humans' questions and made sure everyone felt comfortable before we moved forward with surgery. I personally felt comfortable with her the moment she called me handsome. Then I headed to the back where they checked my weight and all of my vitals. They set me up in my own cozy space for the day with all of my blankets and toys, and honestly, it felt like a VIP suite, but without the food service. A doctor gave me a full exam to make sure my heart, lungs, and everything else sounded and looked good before surgery. They said everything looked perfect, which I thought was already pretty obvious. I was also prescribed a medication called Meropitin to take the night before surgery. This helps prevent nausea and keeps me feeling better during recovery. And let me tell you, no nausea, no drama, 10 out of 10 experience. Would pre-medicate again. I got a little injection in my muscle that helped me relax. It normally makes some doggos vomit, but thanks to my Meropitin, I didn't feel anything. 0 barfs, a personal record. There wasn't just one person helping me though, there was a whole squad dedicated to me, just as it should be. They were all trained in anesthesia and monitoring and all working together to keep me safe. Once the drugs kicked in, it made all of the poking and weirdness a lot less stressful. Honestly, I barely remember a thing. They placed an IV catheter so I could get medications and fluids as needed, and then gave me something that made me doze off. I think I remember hearing them call me a lightweight, but I might have dreamt that. Once I was asleep, they placed a breathing tube down my throat so they could control my airway, and they monitored everything. My heart rate, blood pressure, oxygen levels, you name it, they were monitoring it. They also performed something called a TAP block, which apparently stands for transverse abdominis plane. I don't know what that really means, but what I do know is I was less painful during recovery, and I'm a big fan of that. It numbs all parts of my abdomen and helps control pain for up to 12 hours after surgery. The surgery I had is called a laparoscopic-assisted gastropexy. Big words, but important meaning. It basically attaches my stomach to my body wall so it can't twist or flip, since apparently my stomach is capable of doing acrobatics without my permission. Honestly rude for it to even consider doing that. That twisting, called bloat or GDV, is a life-threatening emergency, and this surgery helps prevent that from ever happening. Once I woke up, I was in recovery with a nice and warm heat support and dedicated technician to monitor me. To be honest, I was a little groggy, like when you wake up from a nap and forget what year it is type of groggy. But I wasn't alone, and they made sure I stayed comfortable and had all of my favorite things to feel safe. I also got laser therapy after surgery to help reduce inflammation and improve healing. Yeah, freaking lasers. I told you this place was fancy. To top it all off, I even got my own personal masseuse to help promote muscle circulation and keep my recovery smooth as butter. Not a bad deal if you ask me. After a few hours of monitoring and a personal assistant taking care of my every need, my doctor and surgery team decided I was ready to go home. My humans learned everything they needed to help me recover when they came to pick me up, and we even got a call from the surgery team the day after surgery to make sure myself and my peeps were comfortable in my recovery. Even though I wasn't sick, this surgery could save my life someday, and my humans say it's much cheaper and smarter to pay for it now than in the case of an emergency. Thanks to the surgery, I get more time for hikes, zoomies, and playing with my friends. If you're a big dog like me, this surgery might save your life one day too. I don't know about you, but I've got a lot more adventures ahead of me.